Porcia Vaughn is the Biosciences Librarian at University of Texas, Austin. She is responsible for library services related to biological and life science subjects and centers, focusing on aspects of research support and dissemination, teaching and learning, and collections. Ken Ripperger-Suhler is a clinical assistant professor of health sciences at the University of Houston. He served for 6 years as an evaluation consultant to the Texas Department of State Health Services HIV STD TB unit. While at the position, he created a system of outcome monitoring and provided technical assistance on community mobilization for HIV prevention programs. And last but not least, Michelle Catalano, just to the left, is the Director of Library Services for the Health Sciences at the University of Houston. Currently, she is planning services for a new health sciences library opening in fall 2017. She has over 20 years' experience in medical libraries, including 14 years working under a National Library of Medicine outreach contract. So welcome, all of you.
Thanks. There were many players in this project, so we tried to bring as many as we could. Big shout out to our data librarian, Josh Ben, who couldn't be here today. I'm going to get as close to his data analyst skills as I can, but I'm going to give you hopefully enough that you can take away and possibly do some of the activities yourself. So our kind of academic title is Working Towards Convergence. What does that actually mean? Well, the way I put it when I go out to talk to faculty about adopting open data and doing projects and working with your library is really students get the opportunity to map their future, map the future of their community's health. So we had an opportunity to identify faculty that may be interested in adopting learning objects using open data sources to embed in their course to possibly give their students data literacy skills. We know that many healthcare workers today are that are increasingly dependent on data decision and decision making for policy, for health outcomes, for treating patients. So we know that our students need to have some data skills in the undergraduate level as they roll out into the professional group. Students at our university were noticing that they were not familiar with data and that they are usually familiar with proprietary data sources, but not the open data sources that they would be encountering in the field. So one of our solutions was to make a data dashboard, creating these tools that the students would interact with in the classroom, give them some experience, give them projects that they can put on their CV. That way when they roll out into their communities, their healthcare communities, they would be able to provide some knowledge, creativity around using data sources. So let me set the stage. The University of Houston is approximately 40,000 students. It's a Tier 1 institution, Hispanic serving. It's been noted as the second most diverse student population by U.S. News, World and Report. We've got about 300 programs, undergraduate, graduate, and professional programs from optometry, nursing, to the health education and PH programs. Library consists of, how many libraries? 4 libraries on campus with a new biomedical health library opening soon. We have subject liaisons, so I was the subject liaison at the University of Houston where I liaised to the Department of Health Education, along with functional librarians like the data librarian who was there to assist with consultations along with creating learning opportunities within the classroom. And working directly with faculty similar to the project you saw before us. The bottom picture is our active learning classroom on campus, which Dr. Ken had a close connection to the person who runs this facility, but we have lots of new active learning spaces open on campus that gives us opportunity to do dynamic, interactive activities, along with having technology, computers, laptops, visual displays to get that interactive active learning, problem-based learning going in the classroom versus the lectures. So our project with the data dashboards, we used a variety of data tools software and data sources. This is not all of them, but I wanted to give you an idea of what we had available. So Tableau was our main interface that we used and data analysis tool, visual tool that we used. ArcGIS, we did have campus licensing for that, Trifecta Wrangler, QGIS, NodeXL, we used the free version to do social networking analysis. As far as the data sources, they came from a variety of places. Before we did our data sources and picked where we were going to get that information from, we really needed to sit down with the faculty and discuss what is your project, what are your learning outcomes, what are you trying to accomplish, what does it look like, what's your research question that you want the students to engage with. So we did projects based on where in Harris County would you find lead exposure, where's possible areas of lead exposure so that we can go out to that community and provide some kind of health intervention. Maybe it's an educational program. We did the case study that Ken's going to talk about a little bit later, HIV, where's a possible at-risk population to provide some intervention like a mobile clinic. So after having that conversation with the data librarian and myself, we sat down and really decided to map out what are the stages, how do we build this project to be able to create this learning object. So one, we created a data management plan. What is it going to look like? What resources do we need? How do we preserve and archive this information? How are we going to make it available to not only the students in this class, but how can we make this project have some longevity? Like the previous speaker, it's, okay, we did this project, who's going to update that data? Who's going to keep it going? So we were trying to think about those concepts before we got deep into the project. So the data management plan included the software, try to go free, because again, if we left the institution, we wanted others to be able to replicate what we were doing and reproduce what we were doing. Collecting the data sources became an issue of, how is this tool going to be used in class? Who's going to have access to it? Do we need to have, is the data clean? So that was an issue. We could possibly find open data sources, but the data was so messy. No matter how much we tried to wrangle the data, get it normalized and into a format that we could use as a cohesive package, sometimes we had to revert to the proprietary and lock our process down. So that was disheartening to Josh and I. It was, why can't this data be clean and usable right up front? The other issue we had with the collection data was finding proxies for it. So we know with HIV risk that there are intravenous drug users are high risk for HIV infection. So we decided to use crime reports to see drug use cases, incidents, and map that out through GIS. So it's not a one-for-one relationship, and we had to mention that to the student that this isn't fact that these are all intravenous drug users in this area. It's just there has been possible drug use in this area, so it might increase. Sorry, that was my alarm. So that was really important for us to think about. So after the data source, we did have to analyze and do the data wrangle. So we used Trifecta, and then we built our visualizations, which I think they are beautiful. This is not the last iteration of it. We had multiple iterations of these visualizations to get to a space where students were able to use and interact with this. So building this visualization, we were able to embed it into the course LibGuide. So they had other information about the data sources. So the methodology in which the data was collected was going to be available to them, using other data tools where they can find the statistics or the flat data versus the interactive to do a risk index. So here, they were allowed to select up to 5 indicators to create their risk index, using a drop-down menu of about 25 to 28 different indicators that related to the risk for HIV or the possibility of creating a mobile clinic. Then they got to decide what weight did they want to give that indicator. So if I'm doing a risk index score and we need it to equal 100%, say in this instance, adult health, fair to poor, this was again free HRSA data, I believe, is where this came from. And they were saying, okay, if I want to identify a neighborhood in the city that we're looking at the adult fair to poor category, not healthy, fair to poor, how much weight do I want to add this into our analysis to create this risk index? Once they've used all the indicators or the indicators they chose, and it was all based on the literature that they read to back it up, they then were able to identify locations within our city, Houston, within the county, to say, where are the hot spots? Where are the areas that I really want to focus and target our interventions on? So this got to how we built the dashboards, and Michelle's going to talk about kind of the support and the library's fit.
Okay, so how does the library fit? This, by the way, is a picture from the Library of Congress in the early 1900s. Love all the little cards from the card catalog. By the way, I really wanted to steal a card from your card, but I held off. I'm like, I want one of these. And why I'm kind of preaching to the choir. How many librarians I have in the room? All right, we're pretty much mostly librarians, and it's an easy sell for us, but it's a hard sell for people on campus. I was talking to Dr. Ken earlier, and I said, well, how did we get this started with you? And he said, Josh came to a presentation, which I also happened to be at, and it was a great room full of very similar people, similar size to what's here, and just that one talk motivated an entire room of people who thought, I didn't know the library did that. Okay. Because there are indeed lots of disadvantages to working with data. When I was in library school, which is 20 plus years ago, there was a saying that the internet was the world's largest library, but all the books were on the floor. Not all data is created equal. Some of it's collected improperly, some of it's incomplete, and some of it, quite frankly, just belongs here. Also, raw data in and of itself is completely useless. Even if you have people who can make those wonderful charts and these great graphs, if you're using the wrong data, or if you're using data that was created for not that purpose, or you're making bad conclusions on good data, what do? So, enter the librarians to the rescue. Dun, 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 dun. Librarians are skilled in data acquisition, data literacy, data cleaning. I know I'm preaching to the choir here, but there's a lot of people on our campus who did not know that, and probably to this day still don't know that. So when we were looking, we were trying to teach them how to acquire data, and we would tell them, instead of going to citydata.com, which a surprising number of students went to, they could go to the census. Sounds perfect. When they're looking for AIDS data, they could go to AIDSview if they were looking for local data, or CDC, or AIDS.gov. All of these groups, nothing against citydata.com, by the way, but census is better, let's be honest. And what we were able to do was to pull that data that Porcia, into the data dashboard that Porcia showed. Data literacy was also a big thing that we needed to teach our students. Not only how to collect it, why you collect it, who's responsible for it, but the ethics behind it. Who's creating it? Why? Is it being updated? And finally, one of the great things that we had under Josh in particular was our ability to clean data. We didn't clean all of the data, but we did clean a lot of it, whether he used scripts or whether Portia, we were talking about doing it manually, talk about fun, manually cleaning data. And so what we were able to do was to take it, normalize it, and put it into a form where, and this is the most important thing, people could take the information and create knowledge. And I do want to stress, for those of you who are data librarians here, believe it or not, probably do believe it, this is not common in all libraries across the country. Okay? I've spoken all throughout the country, and you guys, believe it or not, in many libraries are on the cutting edge. So when you do start making these projects, when you do start doing things like Portia, Josh, and Ken did, please promote that amongst your colleagues, because librarians can do great things. Without further ado, what is it that we did? Did case study.
So before you all drift into a post-lunch coma, let me see if I can give you something to actually talk about. I'm going to go back to that slide, but I want to go here. Student learning outcomes. This is your time to talk with your neighbor. So I want you to speculate as to which of these students had had no encounter with. Brief review of the literature, creating a geospatial map, going out into a urban setting and saying, oh, that's an indicator of poverty. That's an indicator of high African American prevalence in this area. Perform an interview. Perform predictive analysis with secondary data. And understand and compare different types of data. So you now have, this is what I do in class all the time, you have 45 seconds to share with your neighbor what you think and why was the least common thing people had done. Go. Undergrads. What had they least, the fewest of them had done coming into this class? These are undergrads. What is it they haven't done when they walk in the door? Okay, enough of that fun. So, what do you think? No, collaborate. They all, oh, we're great at that. We can teach it. We know how to do that. Obviously, geospatial mapping is not a normal part of the curriculum, so that was high. What would be your greatest disappointment if it were true? The first one. Stunning how few students had actually done that, and they were juniors. That's like a disappointment. So I found that very interesting when I was looking at my course evaluation. So where are we? Okay, so there we are. Houston gets direct funding from CDC because it's got so many sick people. I used to work at the state. We could hardly fund them at all because all their money was coming directly from the feds. They're in the top 12 and have been forever. We're one of those large urban southern areas just crawling with uneducated people getting sick. And it's not just true about HIV. So I wanted to do this class. When I took this teaching job 2 years ago, I wanted to, get into this flipped classroom and do problem-based stuff. And I had my first year was 4-4, never done any of these classes before. 2 weeks to prepare. Okay, that's when I got my teaching assignment. So would this have happened on my own? Right? You've seen the picture of the guy up in the tree with the alligators around him, you know that caption? So people ask me how it went at U of H, and I said, well, you know, the basic support in the department has been wonderful, but my playmates are much better. And these are some of my playmates. So what we did was create a class, and it's evolved over the last 3 semesters, not the first semester. It's problem-based, flipped classroom. They come into that active learning classroom, and because there are laptops for everyone who doesn't have one, everybody is working every day for 75 minutes. Done. Lecturing, thing of the past. IRB exempt because all we asked for was expert opinions and reported anonymously. Field work, they had to go out, and so my piece of the working towards convergence was we created this digital map, but then they had to go out in the field and validate their observations on a factor. Is this neighborhood really low income? And they had to create scorecards with 3 indicators to measure the factor they studied as an individual. Group teams of 4 to 5. So then they had to do interviews with key informants that had some awareness of the neighborhood. So now they've got a sense of, gee, does that map I created with a fancy software based on my online research, does it fit reality? So that's part of my convergence idea. Without the active learning classroom, this is incredibly much harder because there's always, as I've looked at what resources in the active learning classroom were important to you, 20% did not have a laptop. So now I've got to redesign my instruction because they can't all be working. But here, I can do what I please. So whether you've got a pad or whatever you've got, any kind of tool to get online, we have great, I think we have stunning access bandwidth for doing this. And I also use a lab on campus where we have some SPSS access. And I took a select group of students there to do some data analytics. So that's the structure. These are the things I hoped would happen. We've talked about that a little bit. I don't think I'm going to belabor any of that. Let's see, yeah. So I had a previous relationship with AIDS Foundation Houston. I developed some outcome monitoring tools for their various interventions. So when I moved to Houston, I called up my buddies and say, let's play. And so we developed a relationship where last semester was kind of more schoolish. This semester was, we are your research arm. And so when the students walked in on day one, it was, school's over, we're ready to go to work. If you don't want to do that, get a new class. And so we had this different tone for the whole class. Yesterday they presented. And normally I would be scared to death having undergrads, oh my God, with questionable preparation, presenting to experts in the field. And I woke up in the morning and said, they got this. Because we could walk through their presentations, their posters, their PowerPoints. They were concise, they were on target. And I'm thrilled to say that when they left, my two buddies from AIDS Foundation Houston said, we actually got a few new pieces of information, which is not necessarily going to be true because they've got decades in this work. So referring to our reference to communities and building communities, this relationship is going forward. I'll take a couple of those kids that were really gung-ho in the computer lab. They're now going to have internships doing quantitative analysis with AIDS Foundation Houston. They've got access to great health department data, and they start to have a couple were really sort of creative in how they tried to predict high incidence areas in town. So that relationship will grow, and you've got to have these kind of relationships. So what benefit do we get? From looking at the students, most of them are saying that they're now able to, on a scale of 0 to 10, from I'm clueless to I could teach this, many of them had shifted towards the I can teach this skill, thinking about the objectives, and they've been exposed to things which hopefully will get them hired and allow them to function professionally. I think that what was created in terms of visualization is not the Esri standard, if you're familiar with GIS. It's not the highest functional level, but it's pretty good. And they're now comfortable. They'll even say to you, oh, I can do that, even though they have a ways to go before they could take a more sophisticated program and run it. Community health-wise, if we identified one clinic that AIDS Foundation Houston didn't know about, that didn't have an HIV specialist, that didn't do routine testing, they will go in and they will train the staff in that clinic to be more sensitive to HIV issues. By definition, because of the way we did our research, they're located in high prevalence areas. So you've got areas with 2 or 3 very rundown clinics, a population full of HIV infected people, and now they may be able to actually work sensitively with and successfully with their population. And if we're right, if we hit any hot spots that we found a pattern of, from one year to the next, you'd see increases in new cases, decreases. We had testers come in for a panel discussion. Why is this happening? Well, we hit an area hard and then we back away because there's more of Houston than we can cover in a year. Even when they're very focused on making their contract numbers and they know they've got to go to those tried and true places, there's some places they hit periodically. So you get areas that are going to be on the rise. If they went down last year, they'll have more cases this year. So we found some interesting patterns. Hopefully that in the end will lead to reduced infection rates. That's pretty bold, frankly, for the level of research that was done, but we'll continue that and we'll refine that research. So enough said on that. And so I just want to thank this team because I couldn't have done like the most fun teaching I've ever done in my life where students actually came up and shook my hand yesterday. You know, I got to enjoy that. But it wouldn't have happened without these people, because I was neck deep in trying to produce 4 classes. I don't know if you've ever done that, but you're busy. You're neurotic. You're a lost cause. And so all those great dreams of how you're going to do this beautiful instructional piece, they kind of slip, you know, they get taken care of 2, 3, 4 years later. We were starting on this process my 2nd semester because the energy of the librarians. So I now hang out with these disreputable people, these librarians.
So a wonderful job. I'm really fascinated. I'd love to be involved with a project like this at my institution. So you worked with open source data. What about taking the next step and working with open source tools? I saw SPSS. What about using R, working with ArcGIS, which it's an industry standard, but QGIS or something, Tableau. Also, these are very expensive tools for students. They have access now, but
Right.
what about taking that next step?
So there's an open version called PSPP, isn't that cute? And we're going to trial that in the summer. Yeah, Esri's ArcGIS is costly. Although we have site licenses on campus,
Yeah.
that's a lot to ask. You know, I think maybe the best thing is, that's such a sophisticated skill, especially if you want to integrate any kind of analytics. Did I shut down? Ding. Are we there yet? So I think their comfort with it and their being willing to grow and learn and go to workshops and maybe find an employer who will train them further is maybe, it opens the door psychologically for them. If not, you know, in terms of true hard skills, I think it gets them in the door where they're willing to try because they found it was fun and interesting.
And
I
we
think it's
did-
a realistic evaluation.
We did use Tableau Public for so that's we did have a library license for Tableau, but we ended up using Tableau Public to be able to create the interactive visualizations and QGIS. So we were trying to stay tried and true to open as much as we could because we wanted that methodology to be shared with others who want to reproduce or recreate something similar in their space. So we've been talking about how do we write this methodology up and share it so that others can replicate it. But it came down to when data was messy or we couldn't find close enough data, but we had proprietary data available. That's where it became, okay, how far do we want to push it? What is the goals of the class? What are we trying to do? Who's the researcher or who can reuse our tool that we create? That's where it started to get kind of blurry and fuzzy when we switched over to the proprietary stuff.
I think the good news is that Michelle and I have agreed to do some refinement work on the database because this is going to be an ongoing project, either with AIDS Foundation Houston or if they decide we've done what we can do, we'll find a new organization to work with.
And I do want to say really quickly, based on the project that was done here, the library, I think it's based on a lot of the work, has now had in its strategic plan, we do have more of a data focus. And one of the things that we've been talking about is having training in R as far as our computer lab goes in the future.
Hello. Hi, I'm Julian Schneider from Harvard Catalyst, but before that, I was part of the Research Data Curation program at UCSD, and it had just started up. So going in, I had some assumptions that were proved completely wrong. I was wondering, what were some of the assumptions going into this project that you had that were completely overturned and or that were confirmed?
I'm going to pass it to Ken to see, because honestly, I don't think I didn't struggle with the creation process. You know, I knew finding open data to hit some of these points that we were trying to communicate to the students were going to be a struggle. I knew that trying to find the literature for the students to match the data and put in this tool was going to be a struggle. So that, I mean, it hit the mark on that. So I think what's curious is working with Ken. What changed or what?
You know, I have no nuance on this question because I was insulated from all that struggle. That's what they did for me. They provided a tool I could use, and there's no way I had the time to be that deeply involved at that point in my career.
All right, what about the students themselves and their knowledge and how they came to it?
Okay, I can actually, that's where I was going to go. One of the things we found out with the very first semester is that we spent a lot of time teaching them how to use real basics in Tableau, how adding, uploading data. And then we realized, I think based on their skills, that it was better for them to actually analyze the data. We were starting way too high.
Give them the tool right away instead of trying to work with the data and do the packaging, repackaging of it. That was too much for the students in the semester. I think also I was very fortunate enough to work with Josh Ben on this because he was working at 4 a.m. to do a lot of this. And to, again, his second semester, and this is a couple weeks before the semester start, it's like, we got to turn this around quick. So there are data proxies that are probably really bad data proxies, but it was more to get the concept along than to actually be a method that could be publishable, peer-reviewed kind of thing. So.
Any other questions? Well, I think we're on schedule to have our afternoon break, so thank you very much.
Thank you.